Okay, we're talking about reproduction in large animals today. And we're going to start by talking about horses. Of all the domestic animals, reproduction is most difficult in the mare. We actually are only successful about 60 to 75% of the time. Bacterial abortions are pretty common. The clinical signs, obviously, abortion, discharge from the uterus or from the vulva. The mare will return to estrus. She won't actually retain a pregnancy and will get a premature milk let down. Treatment is after a bacterial abortion. Once they have aborted the fetus, then the mare's uterus should be flushed, and we'll put antibiotics directly into that final liter of flush. So we're flushing it out with antibiotics as well. We want to give them some systemic antibiotics as well as the local antibiotics that we've already flushed into there. If we are really concerned about the type of bacteria, really anytime we see a pustule exudate, we should be doing a culture and sensitivity. Viral abortions are the most common one is the herpes virus type 1. It is one that we want to vaccinate against. It usually occurs in the last trimester. More than one mare will be affected because the virus does transfer from mare to mare. Now, often horses, when they're in a breeding situation, the mares are often kept together in one location, so it's very easy for them to transmit this disease. The diagnosis would be virus isolation from the aborted fetus and the placenta, so we'll send it away for diagnosis. We want to wear gloves when we're handling that aborted fetus and the placenta. We want to let the owners know that pregnant mares should be vaccinated with a killed vaccine at 5, 7, and 9 months gestation to prevent viral abortions. Dystocia. Dystocia means difficulty giving birth. In the mare, the second stage of labor, this is where we see the dystocia. From the time the amniotic sac ruptures to the time the foal is delivered should not last more than 20 minutes. If it's at 20 minutes or even 15 minutes and we're not seeing an explosion of the foal out of the mare, we need to be calling that vet. This will depend on mare foal size. So if the foal is bigger than the mare's vagina or the pelvic canal, then obviously they're not going to be able to come out. Twins can cause a dystocia, and then a malpresentation of the foal. Here's an example of a malpresentation. The foal should be coming out in a diving manner with his front feet pointing out and his nose following. When the head is turned back, they're unable to get through this smaller space. So the treatment would be, if we can, we want to correct the position of that foal in the birth canal. If the foal is determined to be dead when we do a vaginal examination, we will have to do a phytotomy. A phytotomy is when we cut the foal into pieces that we can remove from the mare's uterus. As a last resort, we'll do a C-section. Now, with a cow or a large animal, a C-section tends to be one of the first things we want to do because they don't have as many complications following a C-section as a horse would do. Endometritis simply inflammation inflammation of the lining or of the uterus. Clinical signs would be they cannot conceive. They may have a vulvar discharge, but they may not, and there often is fluid accumulating in the uterus. Treatment would be to lavage the uterus with antibiotics because often this is due to bacteria. Oxytocin, remember what oxytocin does, it creates uterine contractions, and so it will help to remove fluid from the abdomen and decrease the inflammation. Diagnosis through culture and sensitivity, we can ultrasound, we can do a uterine biopsy. With mares, or we want to breed these mares just a few times, or as few times as possible during the cycle. The more that they are bred, the more damage to that lining of the uterus. We can surgically correct any problems if we have a vulvar conformation problem where the vulva lip kind of sticks out a little bit further and creates a shelf where feces can land and cause bacterial infection. It's called a Caselix procedure when we do that. Contagious equine metritis. We'll see 10 to 14 days after breeding, we'll see a copious mucopurulent discharge from the vulva, and the discharge usually stops within 2 weeks, and then mares become inapparent carriers. So this contagious equine metritis is a sexually transmitted disease. A bacterial culture and sensitivity will let us know what's going on in there. When we do test the stallion, we'd like to test the stallion before we use them for breeding. So what we do is there within the penis of the stallion, there is something called the urethral fossa. It's just the indentation where the urethra comes out of the penis, and at the diverticulum of the penis, we're going to take some swabs, and this is something typically done before you use the stallion for breeding. And we're going to be looking for this contagious equine metritis, or this bacteria that will cause this contagious equine metritis. We can also look in the mare within the clitoral fossa. This is again a little indentation just below the clitoris in the mare. And these are where we will most often find this bacteria. Treatment, antibiotics may actually not be effective. Our main goal is to clear the organism from the uterus and the clitoral fossa, the sheath, and the urethral fossa and the urethral diverticulum of the stallion. We want to wash the areas at least once daily for a week with Chlorhex scrub, and clean, clean, clean. And that is the best way to get rid of it. Antibiotics are very difficult to get into these particular places. A retained placenta. Placenta membranes are seen protruding from the vulva after 3 hours. Vaginal discharge if there is a small remnant that remains in the uterus for several days. So we should be getting that placenta should come out fairly quickly after the foal's birth. We may see laminitis if it's been 48 hours with a retained placenta. Remember, anything in the horse that causes any type of inflammation, all that inflammation travels downhill into the feet. The mare may show some signs of systemic signs of illness as well. To diagnose it, we could palpate the uterus and the placenta through the vulva. We can visualize the placental remnants within the uterus. Those are ways that we can take a look and actually see the placenta. To treat this, so here is the foal on the ground, and here's the 3rd stage of labor when the placenta is coming out. To treat it, we can use oxytocin. We want to use that to assist with the uterine contractions and the expulsion of the contents from the uterus. We can do a uterine lavage to really gently wash out anything that might be retained within the uterus. Gentle traction to slowly remove it. Some farmers, I see this more with cows than with horses, but can hang a half full milk jug from the protruding tissue, just to put like 2.5 pounds of pressure on that placenta to slowly bring it out. If the placenta is hanging after a few hours, we want to tie a knot in it so the mare doesn't step on it. So we'll take this and bring it up off of the ground, tie a knot on it a little further up so that she's not stepping and ripping it. We also don't want it dragging on the ground for too long either, because it can be a nice host for bacteria. We can use banamine, which is also known as flunixin meglumine, to bind endotoxins, and then systemic antibiotics may be needed if we do have a retained placenta. An ovarian cell tumor is usually benign, but it produces a lot of steroids. Clinical signs would be a persistent estrus or anestrus, so they don't come into estrus. We might see aggressive behavior, and the mares may actually be in pain when they're ridden or handled. So they'll have basically a big mass on their ovary, which is near their kidneys. And if you know where their kidneys are, it's near their back muscles. So when they're turning their back or when they're being ridden, they can be much more painful. We can diagnose it through ultrasound, and usually when we're doing ultrasound on these, we're sticking the ultrasound directly into the rectum and into the colon. We can also palpate this rectally. We can stick our gloved hand into the rectum And we can actually feel the reproductive tract in that way. The affected ovary will be noticeably larger than the unaffected ovary. So treatment would be removal of the ovary. Rupture of the uterine artery, clinical signs, the mare may be found dead in her stall. So it's pretty serious. We'll see pale mucous membranes, colic signs, weakness. Basically, they will bleed out into their abdomen. We can palpate the broad ligament if we feel for a tear or hematoma formation. We can diagnose this. The mare has to be kept quiet. If we do find this, we want to put her in a dark stall and sometimes even just keep her sedated for as long as possible until that clots. Uterine prolapse. Prolapse, we usually see it in mares who have had difficult delivery. So they're pushing. They push out the foal, they push out the placenta, and they push out parts of the uterus. We can diagnose this through visual confirmation. Very easy to see this, and we can palpate this. To treat it, we want to keep the uterus moist. If we use a hypertonic saline, that will not only keep the uterine mucosa moist, it will also pull fluid out from those tissues that are all now edematous, and it will help to shrink the organ, which will allow us to more easily push the uterus back in. We may have to sedate or give anesthesia. We can give oxytocin, but we do not want to give that until that uterus is back in place. And the other thing we'll need to do once we do have this back in place, and this needs to be well cleaned before we put it back in place, we'll place antibiotics inside the uterus and we'll suture the vulvar lips shut for a short period of time to keep that in place. Rectal tears are potentially deadly. They're graded 1 through 4, and they typically occur at the time when the animal has just given birth and it's been a rough birth. So any time that we palpate a mare, we put her at risk for rectally tearing through her rectum. So if we have any blood on our sleeve after we palpate, or there's signs of colic or septicemia, we need to immediately refer this animal to a hospital facility. We're going to put her on antibiotic therapy. We'll do a surgical correction. Put her on some wet or soft feed so there's no further damage to her rectum. And then we may have to have her on fluids and Banamine to bind those toxins. It's also an anti-inflammatory and works well with the organ tissues. Cryptorchidism is a condition of the male where one or both testes do not descend into the scrotum. We do not recommend that we breed these animals. Surgery is required to remove those retained and descended testes, and just like with dogs, if there is a retained testis in the abdomen, they're more likely to get testicular cancer. Penile paralysis. The clinical signs are that the penis drops as it normally would, either with breeding or with urinating, but it does not retract. So either the stallion does not achieve, or the stallion cannot achieve erection in this way because the penis, even though it is dropped out, it is flaccid. And that portion of the penis that's distal to the sheath can become edematous and swollen and not be able to get back into the sheath. We want to treat whatever underlying causes we may have. We can use hydrotherapy where we're actually using a cold hose on that area to reduce the inflammation. Furosemide will remove the fluid from that area, and there are times when we actually have to remove a portion of the penis. Although the penile paralysis is rare, acepromazine is a sedative that we do avoid giving to stallions and geldings because it can cause penile paralysis. Fescue toxicity occurs when mares graze on fescue pastures, tall fescue pastures that have an endophyte that is infested within the fescue. It's kind of a mold. This tall fescue is a cold and insect-tolerant, tough, nutritious grass, so we often plant it in our pastures. When it gets too long, that's when we tend to have these endophytes infesting the fescue. Clinical signs would be a prolonged gestation, so sometimes as long as 13 months, or we'll have dysmature foals. They're not, they may not be premature, but they could be overmature. We'll see thickened placentas and agalactia, and then weak foals due to the lack of energy from milk. And we'll also see immunocompromised foals because there's no colostrum. We can diagnose based on clinical signs and presence of that endophyte in the pasture. We want to remove mares from pasture about 60 to 90 days before they foal. So that's 2 to 3 months before they foal, basically in their last trimester. We may need to provide assistance when foaling. We're probably going to need to tube feed the foal and have colostrum on hand, and some domperidone, which will help the mare um, uh, to produce the milk. Okay, we're going to talk a little bit about equine neonates in this lecture as well, and some problems that we see with this. So the first one is failure of passive transfer. We have talked about this in the past. What we might see is the mare may have a distended udder, but the foal appears to be septicemic and maladjusted. It's not growing well. It's very sick. We can perform an IgG test, which tells us if they have immunoglobulins from their mother. If it's low, we want to give colostrum from a nursing mare, a mare that has just given birth within 12 to 18 hours if we can. If it's been after 18 hours, then we need to give plasma transfusions. We can freeze colostrum for future use in breeding operations where we see this as a problem. Neonate isoerythrolysis is when the mare's antibodies attack the foal's red blood cells. We will see listless, weak foals due to a diminished oxygen carrying capacity of the blood. Also, their mucous membranes and sclera will be yellow, which indicates the lysis of its erythrocytes, so the hemoglobin being released from the red blood cell. Blood transfusions from a cross-matched mare or gelding is needed. If neonatal isoerythrolysis is suspected, we're going to need to muzzle that foal for about 48 hours so that they can't nurse from the mare, and then we're going to give it some frozen or stored colostrum, and we do not want to breed this mare again because it will continue to happen. In Arabian and Arabian cross foals only, we see combined immunodeficiency syndrome. Clinical signs for this is at about 3 to 5 months of age. They have any sign of illness. That's the first thing we should check if it's an Arabian or an Arabian cross foal. Basically, it's they don't have a proper immune system. There is no treatment for this. We can do a CID or DNA test in the mare and the stallion. If both or even one of them carry the gene, we do not want to breed these guys. So this is a genetic disease that will cause death of the foal. Sheep and goats. Campylobacter or vibriosis is one of the most significant causes of spontaneous abortion in sheep. So I want you to remember that Campylobacter, also called vibriosis, causes the most spontaneous abortions in sheep. What we see are late-term abortions and stillbirths or weak lambs. We can diagnose this through isolation of the organism from the fetal abomasum, from the placenta, or from the dam's vaginal discharge. Treatment is penicillin, streptomycin, tetracycline. During an outbreak, we want to give tetracycline or oxytetracycline in late gestation preventively in order to prevent these abortions. So if we're seeing this, especially we can look at the dam's vaginal discharge prior to lambing. Chlamydia, carried by birds. We'll see, again, late-term abortions, and the females may be anorexic and febrile shortly before they do abort. Tetracycline is the antibiotic that works with Campylobacter as well. We can give that during the last 4 to 6 weeks of gestation, but we can also vaccinate against it. And we do want to be careful because chlamydia is zoonotic. Diagnosis is through a history of abortion, clinical signs, and we can examine an impression smear of the placenta, fetal tissue, or uterine discharge. But again, be careful because that is zoonotic. Brucellosis is a bacteria. We see it mainly in goats, a problem in goats. Remember, this is a zoonotic bacteria, does affect us as well, affects dogs, many other species. We'll see abortions during the last trimester. We'll see signs of systemic disease, fever, weight loss, and depression. Infected ewes are rarely ill, so it's just they're not sick, but we'll see abortions. Bacterial isolation from the aborted fetus, so we definitely want to test for this. There is no treatment available. We can detect carrier animals, so we often will test breeding animals, dogs, sheep, or goats, primarily, before we breed them. So we want to test any new animals before adding to our breeding flock, potentially zoonotic, and so we'll need to pasteurize the milk as well. Mastitis, it's a fairly common disease of any animal that milks, so mammals. It's the common microorganisms that we culture from here are E. coli, Klebsiella, Mycoplasma, and Pseudomonas. Clinical signs, a swollen, red, warm udder. We may see gangrenous areas to the udder, so necrotic areas that are dying. Thick, discolored milk, and signs of septicemia, so they're sick all over. Diagnosis will be culture and sensitivity for the causative agent. We'll treat based on the culture and sensitivity results. Oftentimes we are doing an intramammary infusion, so we will milk them completely out and then put a teat cannula in here and infuse antibiotics. We may also have to use systemic antibiotics if they're sick, IV fluids, and in severe cases, we may have to do an udder amputation. That's all I have for you today. It's a quick lecture on some common diseases to expect with the reproductive system of large animals.